Imagine a fire starting deep inside your pelvis, just a strange, burning ache that, in a matter of hours, explodes into a full-blown assault on your entire body. One moment, you're fine, and the next, you're in the middle of a confusing and, honestly, a terrifying medical crisis. This isn't a slow burn. This is a sudden emergency, and for a man named Edward, it was a battle that started without any warning at all. Those are Edward's own words. I mean, this was a healthy guy in his late 40s who, in a single afternoon, went from feeling perfectly normal to being so sick he could barely even stand up. The pain was just brutal, the fever was frightening, and the confusion, it was absolute. What was happening to him is something that hits thousands of men, yet it's still so dangerously misunderstood. Edward's experience really drops us right into the first phase of this journey. We've got to understand what this crisis feels like from the inside and exactly why it needs immediate attention. This is all about recognizing the signs of an attack that's happening from within.
Let's be clear. This is not a subtle illness. Acute bacterial prostatitis, or ABP for short, basically kicks the door down. It announces itself with what we call a triad of severe symptoms that are just impossible to ignore. First, a sudden spiking fever with violent shaking chills. Then, this intense, deep pain in the pelvis or the perineum, that's the area between the scrotum and the rectum. And finally, severe urinary problems, burning, pain, and that frustrating feeling of not being able to go properly. These three together, that's a huge red flag for a medical emergency.
And here is the first critical piece of information that is so often missed. This is not just a standard urinary tract infection that you can treat with a simple antibiotic. The National Institutes of Health classifies acute bacterial prostatitis as a Category I condition. Now, that classification, it's reserved for acute infections that demand immediate and, importantly, correct medical intervention to prevent really serious, even life-threatening complications. Okay, so you've recognized the emergency signs and you're getting help. This brings us to the next critical stage, getting the diagnosis right. And this isn't just about giving the illness a name. There are very specific rules to navigating this maze, and breaking one of them, well, it can turn a serious situation into a catastrophic one.
The right path to a diagnosis should always look something like this. It starts with a thorough review of your symptoms and your medical history. Then, right away getting urine and blood samples for cultures. That's to find out exactly which bacteria we're fighting. This is followed by a physical exam of your abdomen and genitals, and finally, a gentle digital rectal exam, or DRE, where a clinician can feel the prostate for swelling, tenderness, and heat. The key word here really is gentle. It's a very specific, careful procedure.
Okay, now I need you to lean in for this next part. What I'm about to share is the single most important piece of information to understand when you're diagnosing this condition. It's a critical difference that can protect you from a potentially devastating mistake. In many other kinds of prostate exams, a doctor might perform a prostatic massage to get a fluid sample for testing. For acute bacterial prostatitis, this procedure is absolutely 100% forbidden. The prostate is severely infected, it's swollen, and it's full of bacteria. Aggressively massaging it can literally squeeze that bacteria straight into your bloodstream, which can trigger bacteremia and potentially deadly sepsis. This isn't just a recommendation, it is a critical safety rule. Now, what's so fascinating about this slide is how perfectly it shows why that rule exists. Just look at the difference between acute and chronic bacterial prostatitis. The acute kind is sudden, with high fevers, and the prostate is incredibly tender. The chronic kind is slower. It comes and goes, usually without those big systemic symptoms. And here's the kicker. For the chronic type, a prostate massage is actually required to get the right diagnosis. This is exactly why a doctor has to rule out the acute emergency first before they even think about a standard chronic workup. So, once we've established the symptoms and the really crucial diagnostic rules, the next question is pretty obvious. What's actually going on inside the body during this crisis? Let's dive a little deeper and understand what this infection is doing to the prostate itself. At its core, acute bacterial prostatitis is pretty much what it sounds like. Bacteria, most often E. coli, have invaded the prostate tissue. In response, your body's immune system launches this huge inflammatory counterattack. This is what causes the gland to swell up so fast, which puts pressure on the urethra. That's the tube that runs right through it and creates this localized, high-pressure, hot zone of infection. The real danger of AAPP is what can happen next if things go wrong. The infection can break out of the prostate. Bacteremia is when the bacteria escape into the blood. Sepsis is the body's chaotic, life-threatening overreaction to that bloodstream infection. You could get a prostatic abscess, which is a walled-off pocket of pus that's really hard to treat with just antibiotics. And then there's acute urinary retention, or AUR,
which happens when the swollen prostate completely blocks off the flow of urine. That's a painful emergency all by itself.
So given these dangers, the medical response can't be passive. It has to be aggressive, it has to be fast, and it has to be precise. This is not a wait-and-see kind of situation. This is a search-and-destroy mission against a dangerous internal threat.
The treatment plan is basically a two-phase attack. For guys who are really sick, like Edward was, treatment starts in the hospital. Phase 1 is high-dose IV antibiotics to get control of the infection quickly and stop sepsis in its tracks. Once the patient is stable and the fever has been gone for a day or two, Phase 2 begins. This is when you switch to a long course of very specific oral antibiotics lasting anywhere from 4 to 6 weeks to completely wipe out any bacteria hiding in the prostate tissue.
Now this part is absolutely critical. Not all antibiotics are created equal here. The prostate has this unique biochemical barrier that makes it really tough for many drugs to get inside. So the choice of antibiotic is everything. Drugs like fluoroquinolones or trimethoprim work because they're good at passing through that barrier and getting to the infection. But a really common UTI drug like nitrofurantoin, it's completely useless here. It just can't reach the infection in strong enough concentrations. Using the wrong weapon guarantees failure.
After that immediate crisis is over, the journey isn't done. This section is all about managing expectations for the recovery process. You know, if you're watching this, you're the kind of person who wants to understand the why behind the medical advice. So let's tackle the most common questions that come up during this extended treatment.
This is the question that almost every man asks. You start feeling better after just a few days, so why in the world do you have to keep taking powerful antibiotics for over a month? It feels like overkill, but there's a really important scientific reason for it.
And this slide really breaks down the answer. As we've been saying, the prostate is like a fortress. It's hard for antibiotics to get in. So while you might feel better pretty quickly because the infection in your system is under control, the bacteria hiding deep inside the prostate tissue are much harder to kill. A short course of antibiotics might just knock them down, not knock them out. The 4 to 6 week duration is specifically designed to prevent a relapse into the much more stubborn, difficult to treat chronic bacterial prostatitis. Finishing the entire course is the single most important thing you can do for a successful recovery.
The fear that this could happen again is completely valid. Nobody wants to go through an experience like this twice. It's a really common and important question, and it deserves a straight answer. So what are the chances of this coming back?
And the news on this is overwhelmingly positive. The medical literature shows that when acute bacterial prostatitis is diagnosed correctly, treated with the right antibiotic, and, here's the most important part, treated for the full prescribed time, the prognosis for a complete recovery is excellent. The biggest risk factor for it coming back is stopping that treatment too early. Your knowledge and your commitment to the plan are your best defense.
Look, hearing the word serious and prostate in the same sentence can instantly trigger anxiety about cancer. It's a natural reaction and a very common concern. So let's just tackle this head-on and separate the facts from the fear.
The answer is clear. Acute bacterial prostatitis is a benign infection. It is not cancer, and having it does not increase your long-term risk of developing prostate cancer. Now, the infection does cause a lot of inflammation, which can temporarily make your prostate-specific antigen, or PSA, levels go up. But this spike is temporary. It should go back down to normal a month or two after the infection is completely gone.
We've covered the what, the why, and the how of this condition. Now we get to the most important part of all, what you can do. You're becoming the kind of man who doesn't just passively receive information, but who actually uses it. This section is about empowering you to be an active, informed participant in your own care.
This slide right here is your toolkit. These are the 4 specific questions you can bring to your clinician to make sure all the bases are covered. Number 1, have we ruled out acute bacterial prostatitis? This makes sure those critical diagnostic rules are being considered. 2, is this antibiotic able to penetrate the prostate? This confirms the right weapon is being chosen for the fight. 3, what is the full duration of treatment? This shows you understand how important it is to prevent this from becoming a chronic problem. And 4, when should we do a follow-up culture? This confirms that the end goal is complete eradication of the infection.
And as always, it's so important for me to say that this explainer is for educational purposes only. It is not medical advice. Every person's situation is unique, and you must always talk with a licensed healthcare professional for any personal health concerns or decisions.
In the end, clarity is what gets rid of fear. Understanding the nature of a threat is the first and most critical step you can take toward overcoming it. Edward's story started with fear and confusion, but it ended with recovery and empowerment, because he got the right information and the correct treatment.
By understanding this hidden emergency, you are so much better equipped to navigate it, to advocate for yourself, and to protect your long-term health. I'll be sure to keep you updated as new research comes out on men's health, so make sure you subscribe so you don't miss it.